Further epidemiological research. Further epidemiological research should include an increase of hygienic practices in developing countries to decrease the spread of hepatitis A. Proper hygienic practices should include frequent hand washing, face washing, and bathing with soap and water. This is difficult to do in developing countries due to lack of resources. In order to provide these developing countries the resources to practice good hygiene, epidemiologists should study easier methods to achieve this. Providing developing countries clean/safe water is very difficult given the way that they live. This presents a need for water filtration or other forms of maintaining water clean, such as water storage. Further research should be done to develop alternatives for clean water, such as stronger hand sanitizers or other forms of eliminating bacteria. The need for an increase in health education is also vital for an increase in healthy hygienic practices. More research should be done on providing developing countries with better access to the hepatitis A vaccine. According to the World Health Organization 2018, vaccination efforts should be included alongside health education for sanitation and hygiene practices. According to PATH 2015, studies should also include accelerating research and development of these vaccines, along with how to make them more cost-effective. Research should also go into keeping vaccines viable for longer periods of time, as well as how to store them and transport them effectively. $100 million. Challenges facing vaccine availability comes from poor donor funding. This causes manufacturers to decrease their investments in additional production of vaccines. This increases the price of vaccines and results in more shortages. This is why we would use our money to increase funding. The need for immunization programs is very crucial in the developing world. They save the lives of 3.5 million children a year. Although these numbers are high, approximately 1.5 million children die from vaccine-preventable illnesses. If we had $100 million, we could invest in mass production of vaccines, and we could develop larger immunization programs. This could help a lot of children in the developing world. The money could also be used to increase the amount of health education programs aimed at proper hygienic practices, along with providing them with safe water. We would also use this money to invest in alternatives for safe water.